Meow, I'm Huples cat. Bacterial pneumonia. How to deal with bacterial pneumonia in the now and in a condition of an ongoing disaster.
Pneumococcal pneumonia is an inflammatory lung infection with symptoms of fever, cough, and difficulty breathing. During normal respiration, air travels through the lungs to the alveoli or air sacs. Infection with pneumococcal pneumonia causes the alveoli to fill with fluid, obstructing oxygen transfer. This is commonly caused by Streptococcus pneumoniae, also known as pneumococcus.
Okay, I'm not going to get all medical on you, but the most common cause of death in the world in 2024 from infection is in fact bacterial pneumonia.
The death of Jim Henson came as a big surprise yesterday. He had a bacterial infection that apparently went untreated and eventually took his life yesterday morning.
Jim Henson of the Muppets fame was fitting well at 53 until he got bacterial pneumonia, and about 3 or 4 days later, he died. He said to his daughter he was just tired. He was tired, very, very tired. In fact, he was going to be dead in a couple of days. That is the problem with bacterial pneumonia. It doesn't really present dramatically until the end. When he started bringing up blood, he went to the hospital. At that point, it was too late to save him. His organs were severely damaged by the bacteria. With increasing antibiotic resistance across the planet, there'll be more people like Jim Henson. I'm not saying antibiotic resistance caused his death. What I'm saying is antibiotics aren't going to work. And without antibiotics, a large number of people who currently don't die from bacterial pneumonia will die from it.
Antibiotics, we're wonderful pills, but don't ever think we'll cure all of your ills. Caught a cold, got the flu, feeling under the weather. That'll be a virus, we can't make that better. Take us for the wrong thing, that's dangerous to do. When you really need us, we can stop working for you. So please don't end up paying the price. Always take your doctor's advice.
The whole topic of antibiotic resistance is very, very complicated. I'm not going to get into it here. But I would suggest, if you can, try to avoid eating foodstuffs that have been treated with antibiotics. And yeah, being a vegan doesn't actually mean that you're safe from this particular practice of our food industry.
Common symptoms of pneumonia may include cough, fever, chills, trouble breathing, and a fast heart rate. Chest pain can also occur, especially when taking a deep breath.
If you've got the signs and symptoms of bacterial pneumonia, go to the doctor early. Make sure you get a chest x-ray, make sure they listen to your chest, and make sure if it does suspect it's bacterial, they give you antibiotics. If they dismiss it as viral and you've got the signs and symptoms of bacterial pneumonia, fight your case. The key symptom is temperature, but only in normal adults. Once you get above 65, or if you're a young child, temperature isn't really a key factor here. But for most of us, if your temperature is 39 centigrade or higher, treat it like bacterial pneumonia. The longer they leave it before treating with antibiotics, if it's bacterial, the more chance of death. Certainly with temperatures in excess of 39 centigrade, the doctor should not be going, well, I'll wait to see if it's viral or not, because they're gambling with your life. So which antibiotics? I'll suggest them later on. However, how are you going to know if it's a viral or bacterial pneumonia?
When you have a respiratory illness, you might think,
well, I've got a bad cold. I'll get over it.
But Dr. Vandana Bide says sometimes you don't get better.
If somebody's coughing up a lot of stuff, it may just be the tail end of a cold, but if it doesn't go away, it may be a pneumonia.
Pneumonia, a lung infection, comes in two forms: bacterial, which can often be treated with antibiotics, and viral, which can't. It's tough to tell the difference. Both can cause symptoms that include fever, cough, shortness of breath, and both make you feel run down. The strain called walking pneumonia causes similar symptoms, but you're still able to push through the day.
That's caused by a very specific bacteria. It is treatable.
Doctors diagnose pneumonia by lab tests and chest x-rays. The pneumonia vaccine helps protect you against certain strains.
Okay, I don't know about you, but I still don't quite know if I've got bacterial viral pneumonia from that video if there's no doctor around.
how to tell the difference between two respiratory conditions, one that might go away on its own, the other that may need treatment at a hospital.
Well, while coughing, of course, is your body's way of clearing your airways, a deep cough in your chest could be a signal of bronchitis or even pneumonia. But what's the difference? Well, bronchitis and pneumonia both involve inflammation in your chest, which can lead to that shortness of breath and the wheezing sound. Bronchitis is usually caused by a virus, though, while pneumonia is typically triggered by a bacterial infection.
If you have pneumonia, you're really more sicker than bronchitis. You have a higher fever. They both might have fever. Bronchitis, a low-grade fever. Pneumonia might have a higher fever. You're more short of breath. You might have chest pain. Sometimes you might require hospitalization. On the other hand, bronchitis, it's, again, as I mentioned, it's think of it as a deep cold where typically you might get better without even antibiotics. So your doctor might not even prescribe antibiotic for bronchitis.
And both of these conditions are really going around right now. Now, Dr. Anas Hadeh with the Cleveland Clinic, Florida, says bronchitis typically clears up in about 10 to 20 days, while pneumonia can take up to 4 weeks to go away.
In an ongoing disaster without any healthcare facilities available, you might want to consider starting antibiotics if you see one or more of the starred symptoms here. There are other signs and symptoms. They will vary with human anatomy. But these are the ones I've looked at and gone, I'd really be kind of treating with antibiotics if I was a doctor and I could prescribe them, which I can't. Now, if you're in a higher risk group, you might want to treat earlier rather than later with antibiotics. If you think it might be bacterial and you're in a high risk group, you might want to start antibiotics. If you think it might be bacterial and you're not in a high risk group, you might want to wait a day or two, see what happens, see what your temperature is. But I would point out, in an ongoing disaster, we're all going to be nutritionally deficient and probably immunocompromised. Okay, you think your victim's got bacterial pneumonia. How are you going to treat them? As I said, temperatures above 39 centigrade, you're probably going to treat with antibiotics. But there's other clues as well. The sputum, the phlegm, what they cough up, may well show signs of infection. It may be dark brown, rust coloured, red from blood, fresh blood because of the infection, and it could also be dark yellow, and it might stink awful. All of those signs and symptoms would draw you to conclude that it's possibly bacterial. But I will point out, rarely, bacterial pneumonia can actually have clear sputum. It's rare, but it can happen.
Pneumonia is most commonly treated with antibiotics, which are medicines that kill germs. Most cases of pneumonia can be treated at home. However, if pneumonia becomes severe, you may need to be treated in the hospital. While in the hospital, you may be given oxygen to help you breathe or fluid through an IV to help you fight the infection.
Okay, that video was less than helpful on how to treat a victim. If you can manage their symptoms, try and make them comfortable, but this in no way will get rid of the bacteria that's causing the pneumonia. One of the few things you can do that might help is give them 3 to 5 litres of fresh water a day. This will bring down their temperature, especially if you use Tylenol or Advil to help bring down the temperature. In the presence of an out-of-control bacterial infection, dehydration will kill the kidneys extremely rapidly, so again, give them lots of fluid. You might want to consider rectal rehydration if they're not able to drink enough by mouth or if they're unconscious. Remember Jim Henson. What else can you do? The orthopnic position. Sitting upright, slightly bent forward. Helps open up the airways. Can be done in bed, can be done sitting in a chair. Remember to move them very often from side to side, because what will happen is they'll get pressure ulcer development on the back, the neck and on their bottom and even behind their ankles. So make sure that you're actually moving people who are bedbound or chairbound frequently. That means every half an hour to an hour if you can, maybe 2 hourly at night. Now, sleeping at 90 degrees is probably impractical, but it's worth a try. If they can do that, it's great. But have them at least 45 degrees to the vertical while they're sleeping. And again, tilt them from side to side, back side, back side. Some of the treatment suggests sleeping flat on their stomach, and I think you should give that a go if they have bacterial pneumonia. I think you'll rapidly find that they won't tolerate that because of shortness of breath. But anyway, you can try that. Mainly in ongoing disaster, you're going to need antibiotics to treat bacterial pneumonia. Antibiotics will not in any way help a viral pneumonia, but sometimes viral pneumonias will develop bacterial pneumonias secondary to the viral pneumonia. It gets a bit complicated. So other than breath sounds, one of the key differences between viral and bacterial pneumonia is the temperature. Temperature over 39 centigrade, it's probably bacterial. 39 centigrade or lower, it's probably viral. But there is another indicator that you can use that helps you diagnose. It won't make your diagnosis for you. Do they have a sore throat and a runny nose? It's probably a viral pneumonia, not a bacterial one. Okay, Huples, what antibiotics am I going to use? This is a list of ones I think are possibly available to you without a prescription. But I would point out you should never ever take a prescription medication without having it been prescribed by a doctor. Never ever under any circumstances treat yourself or treat others without a doctor's authorization. So for teenagers and people up to about my age, you might want to treat with amoxicillin and doxycycline. Doxycycline you want to give 100 milligrams twice a day for about 7 days. Now it bears repeating that children are not small adults. They have very specific healthcare needs and antibiotic requirements that are very different from you as an adult. Atypical pneumonia is bacterial and it's also called walking pneumonia, and it comes in seasonal cycles. I'm doing a standalone video on walking pneumonia and it'll actually be next week. The antibiotics I selected are oral form mostly because I wanted to pick antibiotics you could get possibly and could use and treat for bacterial pneumonia in the absence of civilization, in the absence of healthcare. There's an awful lot more antibiotics that would be used for bacterial pneumonia with healthcare up and running, but a lot of them are IV. So there's been a massive disaster and you happen to have antibiotics and you think you should treat yourself because you've got a doctor there that tells you you can. You decide to treat yourself with these prescribed medications because you know the side effects and you know why you should take them and why you shouldn't take them, what the side effects are, what the interactions are, all of that good stuff. You take the course for 5 days. If your signs and symptoms of bacterial pneumonia have not responded at all during the 5 days, or if they've completely gone away at the end of the 5 days, you're done. Stop taking that course of antibiotics. If your signs and symptoms of bacterial pneumonia reduce significantly but are still present after the end of 5 days, take for a further 2 days. If after 5 days you're still alive and the antibiotics have had zero effect, no effect whatsoever, or after 7 days you still have significant signs and symptoms of bacterial pneumonia, I would suggest, if you have it available, switching the antibiotic regime to a different type of antibiotic. If you can't do that, then repeat the course again. However, availability of healthcare and availability of medications is going to have a lot to do with this. So this is a list of common oral antibiotics that you may or may not have access to. It has some information that you need to know before you start treating with this type of medication. Generally speaking, you need a book like this. It can be about 10 years out of date. I'm going to renew mine in a year or two. All of the publishers produce different nursing ones of these. This is one I happen to get. It's not one I recommend. I don't recommend any of them, they're all slightly different. So when you look up amoxicillin in this book, what you find is 3 pages of fairly detailed information. If you're going to self-care, make sure you do it from a position of strength and knowledge, not from weakness and ignorance. So I would recommend a nursing drug book. Try and get them second-hand if you live near a university or a nursing college. Absolutely no problem having a second-hand one. It can be 5 or 6 years out of date when you get it. That also is not really going to be a problem for you. Once it gets about 10 years out of date, switch it out. That's it for me on bacterial pneumonia. Like you say, stay tuned because the next video is actually going to be on walking pneumonia. And walking pneumonia is one of those things that comes seasonally every 3 to 5 years. So last year in 2023, it was everywhere, all over the press. So the problem is, being human beings, we completely forget all about walking pneumonia until a couple of years from now when it comes back. But because you're my viewers on my channel, let us learn about walking pneumonia, what you can do to prevent it, what you can do to cure it now, not in 2 to 3 years' time when we're having it everywhere around us. Have a great day. Doodles. This has been a Wolfie Terrier 2024 production.